Hello guys, welcome back to another video. In today's video we are going to talk about episiotomy care and perineal care. Now, I know maybe you are wondering what is episiotomy. Episiotomy is a surgical incision made in the area between the vagina and the anus, which is called perineum, and this sometimes is used to enlarge vaginal opening during delivery. In short, I'm saying episiotomy is a surgical incision or a cut made when a woman is giving birth so that you can enlarge the vagina so that the baby can come out. So after this, after the baby has been delivered, stitches are used to close the incision as well as repairing the tear that may be occurred when you were giving birth. So here are some of the few steps that someone should take to help the healing process occur. And remember, this is just a wound that like any other wound where you need some of factors to help in healing, like you may need good nutrition to help in healing. You may need exercise to help in healing. You may need maybe your condition should be well so that the wound can heal well. I mean, the health status, you should have a healthy health status so that the wound can heal well, because I said it is just like any other wound. The age also, these factors that favor the wound healing process. So this episiotomy sometimes can take time to heal because the woman doesn't take care of the place very well. And now we are going to look at some of the steps or some of the points that a woman should take into action so that it promote healing faster. So before we look at the points, those points, the midwife and maybe the doctor or the gynecologist, the person who is assisting the mother to give birth, will decide when to perform episiotomy. It is not that it is usually being performed to every mother that is giving birth. The doctor or the midwife that is conducting delivery should decide when to perform the episiotomy and which woman that he or she need to perform this episiotomy to. Like for example, maybe you are giving birth and then the baby is big, so they need to enlarge the space so that the baby can pass, because maybe if they don't enlarge the space, you may get a severe tear on the perineum, or maybe you may get you can get a perineal tear, a very serious perineal tear that can cause other complication. Or maybe mostly when the mother who is giving birth for the first time, sometimes they don't always want to cooperate during the delivery. So the midwife can decide to enlarge the birth canal so that they fasten the delivery of the baby, because when the baby stayed there for the long period of time, the baby can get complication. So this episiotomy stitches, after maybe they have after the midwife or the doctor or the gynecologist that is performing the delivery has performed the episiotomy, they usually close it. They usually close it and it become a wound, and this wound you need to take care of. So episiotomy stitches usually start to dissolve a few weeks and are gone after 1 to 2 weeks. You may notice pieces of stitches when you're wiping yourself, or when you go to pee, you will see some pieces of these stitches, so it shouldn't worry you. So let us look at the tips for episiotomy care. That is the main video, that is the main thing that I want to talk about. That is the main thing that I want to talk about. Tips for care, episiotomy care. So after delivery, most of the time, or not most, even most of the time, the woman should rest up to 6 weeks so that the reproductive system can come back to its normal state. So this time is usually enable the body to heal and all the reproductive system, because when you are carrying the pregnancy, your body overstretch, and sometimes you need time to heal. Yeah, you need time to heal. Not sometimes. A woman need time to heal, and the experts say that a woman should heal up to 6 weeks, and this period we call it postpartum period. So here are some tips for keeping the area clean and promoting the healing of the episiotomy, stitches, and the wound or the perineal tear. Because even if sometimes if you are delivering, you might not they might not perform episiotomy, but you might get some lacerations, and at the same time the midwife or the doctor or the gynecologist can decide these lacerations are not serious or they are not severe, so let's just let the woman heal. Let's let the place heal by its own. And also, maybe if they performed the episiotomy, they would have 2 stitches. So when you have episiotomy or perineal tear or maybe lacerations, avoid tampon for the first 6 weeks, this postpartum period. Avoid using tampon for the first 6 weeks after giving birth. Okay, I also want to say that this episiotomy place might take time to heal. It can go even up to 10 weeks, depending on those factors that I said that favor wound healing. So if you had these factors, then maybe the place will heal very fast. So I'm saying avoid using tampon up to a period of 6 weeks. The next thing that you should avoid irritating the place. Avoid irritating the place by wiping yourself with tissues. You should use baby wipes to wipe yourself so that you don't cause friction that will irritate the place, and also may cause some of the damage into the in that place. So avoid using tampon up to 6 weeks. And the second point is that avoid irritating the place by using baby wipes to wipe yourself when you go to the toilet, or you can just use water to rinse the place clean. The next point, the third point, is keep the area clean. Keep the perineal area clean. Keep it clean as much as possible. If you're using pad, make sure you change that pad for at least after 2 to 3 hours, so that you don't get infection, and the infection spread and may even prolong the process of healing. So keep the the space clean, keep the place clean, yeah, by cleaning yourself well after using the toilet, and also washing yourself well, and also changing your pad after 2 to 3 hours. The next point, you can use medicated pads. We have some pads that are medicated to promote healing. Also, you can this one is a very common point that most of the midwives usually tell mothers in the hospital. If you don't have those medicated pads, then you can use warm water after 24 hours of giving birth. You can use warm water with salt. You sit on that water for at least 10 to 15 minutes, so that it also promote healing. So you can use warm water with what? With salt, and you sit on that water, and then that will also promote healing if you don't have medicated pads. The next point, constipation. Prevent constipation by eating a lot of fibers and also taking a lot of water after delivery. And if that one doesn't work for you, use laxatives so that you don't get another tear when you are going to the toilet. It will prolong the healing. Yeah, it will prolong the healing. Maybe the tear will take place and even you didn't notice, so maybe you will not know, and this will prolong the healing of episiotomy. So what was I saying? I eat fibers and take a lot of water, and also you can use laxatives and softeners to enhance, to prevent constipation. Also, you can take over-the-counter drug, brufen, to prevent, to alleviate discomfort. Maybe if you are feeling pain on that area, you can use some of the painkillers or analgesics to alleviate discomfort or to prevent pain. You can use antibacterial sanitizer on your hand before cleaning the perineal area to prevent infection or to prevent getting infection on the wound in the hands. Also, you can use how do we call this, sterile gloves. You can use sterile gloves when you are cleaning that place. Yeah, you can use sterile gloves when you are cleaning that place to avoid infection. Another thing that you can also do to promote healing is you can do Kegel exercise. Exercise also usually promote healing. You can do Kegel exercise, and then the wound will just heal by itself. So if they performed episiotomy on you and you get these points that I'm going to state, then you should go and see your doctor. You can get infection. You can get infection if you don't take care of that place. Maybe you can have fevers as a sign of infection, and also you can get vaginal discharge that is smelling, or you can get a smell on that perineal space or area. Then also, if the place is bleeding, you should go and see your doctor or the midwife or the gynecologist that performed the delivery. I think I have reached the end of this video, so kindly, if you have not subscribed, please do so. And returning subscribers, thank you very much. Please continue watching these videos. Pregnancy series, we have a lot to talk about. The next video, I'm going to talk about care of cesarean section, the care of cesarean section area. If you have been done for CCS, how can you take care of that place to avoid getting sepsis or avoiding complication, or you enhance things that you can do to enhance healing process so that you don't go back to the hospital because of sepsis. So thank you for watching this video. Let's meet in the next video. Bye.